Good.
Look at COVID and the impact of COVID-19 on our practices, both in practitioner point of view and also from an a chain point of view, as well as employee and an employer panel today. We have Ajay Mishra, who is General Manager.
Actually, your voice is cracking. Is it for me or for everyone?
I think.
Let me just take a pause for a few seconds and then start. I think.
Yeah, net
we could not hear you.
Yes.
Who is
not yet.
Now?
Better.
Okay. Yeah. Can you hear me, Rajesh?
Maybe you can.
Yes, I can hear you. Yes.
Turn off your video.
I can hear you well.
Can you hear me well?
Yeah, it's coming through now, but still not consistent.
Okay, so intermittently, I guess it's getting interrupted.
Better now.
Okay, so I'll just reintroduce everybody. So we have Ajay Mishra, who is the General Manager of Professional Services and Technical Sales from GKB. Then we have Amitava Benodza, who is the Marketing Director of Lawrence & Mayo. We have Snehal Thirakia, who's the CEO of Thirakia Opticians in Chennai. And Rajesh Wadwaji, who needs no introduction, who's a practicing optometrist from Father Optos, New Delhi. And the session would be moderated by no introduction. Over to you, Nilesh.
Thank you so much. I just love those two words, need no introduction. That's the best introduction
no
ever.
introduction.
Yeah, that's the best introduction ever. So welcome everyone, and happy to interact with all these stalwarts, all these friends of ours from the eye care industry. And actually, let me just quickly give you an idea why we are doing this particular session. So I got a couple of messages from some optometrists that why don't we conduct something along these lines, where now that things are improving, we will go back to our practices, we'll start seeing more patients, and how do we go about it? That's one. Secondly, being optometrists, there could be some insecurity. So how do we manage going forward? And as optometrists, how can we contribute to the overall business? So I think they were quite fair points, and I really liked those points. So I came back and I spoke to Lakshmi. There are some optometrists who actually want a session around these particular topics, and she was very kind. She said, why don't we do it through OCI? And because she was so kind, she was kind enough to me, and she said, okay, because you got this idea, okay, this is your session, go on and organize this session and you moderate it. I said, let's do that.
I think you have network issues, sir. The voice is cracking.
All right.
I can hear well.
Okay. So Lakshmi, being Lakshmi, very kind to me, she said, okay.
Can hear it well. Snehal, you're okay?
I can hear him well, yeah.
So we decided, okay, let's conduct a session, and we picked probably the 4 best people who could give us some insights on these particular issues. So here we are, and let me start this discussion with just a little bit of understanding, and I'm going to ask people who are in extreme south as well as extreme eastern side. So I'm going to ask Snehal and Ajay, either of you can start, just to let us know how are the things happening now. So what are the timings, and generally what is the situation in your locations?
Ajay, do you want to take it?
Yeah, either of you, Ajay or Snehal.
So in fact, the government has just announced yesterday that Tamil Nadu can open up from 10 a.m. to 9 a.m. to 2 p.m. starting coming Monday. So that's a good respite because we have been closed for over a month now, and everybody's raring to go, and we are quite optimistic. The things are very, very bad in Tamil Nadu, as you are aware. It had hit an all-time high for a brief period, but then things have been much better since it was closed for almost a month, and now we all of us are waiting back to get back to work. The good part of this second part of this unlocking our business after the second wave is it's not entirely a new scenario for the management or our team or the consumer patient. Unlike last time, there were a lot of anxiety and a lot of apprehensions about opening, about sanitization and protocols and all that. So as far as those things are concerned, there's no anxiety, and we are good to go as soon as it opens.
Awesome. So because we were a little experienced, so it was not so difficult, right? Yeah.
Yes, and in East also, in the second wave, what happened is government was kind enough to consider us as a, they have considered us as an essential service provider,
Right.
and thus we were allowed to open particularly in Eastern region from 10 to 7 p.m.
Quite good. Quite good.
And so which is quite reasonable. I mean, people can come out. If you want to go for eye test, you just have to show that you have an appointment and police won't stop you. So that is the thing in Kolkata. However, lockdown is still going on. It is announced till 15th. Lockdown is there. Malls are not operating. I mean, they are completely shut. So we are struggling wherever we are present in malls. There we are struggling in particularly East. But rest, other regions, the same. We have to abide by local government guidelines. And we have very little things to do. I mean, when government is allowing us to open, we are ready to open. The good part is we are ready. We are prepared. We are trained. We have trained ourselves. We are ready. So as soon as we get go ahead, we go and perform.
Awesome. So सिर्फ इंतजार है ना, एक बार हाँ बोल दिया तो एकदम
Yes.
चालू. Wonderful.
Yes.
So let's not spend time on this aspect now. I think more or less we understand what is happening across the country. The next question is actually addressing the elephant in the room. It's a very, very important question, and probably the high weight question. So I'm going to throw it to the high weights. I'm going to ask it to Rajesh ji and Amitava. Fortunately, both of them also represent different types of practices. One is in the chain business, the other one is independent practice. And the question is, so what is the current scenario and how are you managing the business aspect of it, more from the financial side? And the next part of the question is, how did you manage the salaries of the employees and all those expenses in such difficult times? And we all understand and appreciate the situation. So over to you. If either of you can start.
Rajesh, please start.
Okay, I'll take it. Thank you. Actually, the challenge was how to convince the staff and to also not go into big losses. But the human aspect is always there. We insure our machinery, we insure our premises, but our biggest resource is human resource. If there are no people, it's the people that count, who are working for you, being with you, support you, get your work done, everything. So how I started my conversation with the staff is by telling them the worst case scenario, that many jobs have gone, many outlets have closed down, the losses can't be borne easily. So it was the staff salary, it was the rentals, it was the other aspects of the vendors who supply things to us. So coming to staff, once we started with the worst case scenario that jobs are going and everything, then we also told them, yes, it's been there, you were in lockdown, but let us all accept that our expenses had gone down during lockdown. Even your travel was not required, clothing, even unnecessary shoppings were not there, all those things, and everyone accepted. And then we told them that even if I give you, for example, let's take a hypothetical scenario, that all staff members had requested me during the lockdown that they need money. Yes, of course, they do need money. The families need money. So if there are 5 people and each one of them asks me for 10,000 rupees, I say to you, it sounds 10,000, but from my bank, 50,000 has gone. So my banks are shaken and there were no inputs coming in. Putting these things together, ultimately I said, we don't want you to go into loss, and you would also not want us to go into loss, because that will mean the whole establishment goes into loss. So let us share this, and we settled at 50%. So we paid the staff, even without coming, without doing work, 50% of salary, and all of them were thankful and good, and we were also happy. And that's where we settled. Rentals, yes, it was an issue. Those people who have been on rent, the landlord should consider that the person who has not earned, it's not easy for him to pay, and they should proportionately reduce the rentals. About the vendors, those vendors who supply us on day-to-day basis, which are the lenses, contact lens and spectacle lens, they were cleared first for their up-to-date accounts and balances. But those vendors who are occasional, their checks were made of a later date, and that's how we were managing all this. Yes. Over to you, Amitabh.
Thank you.
What more would you like to add?
Hello, everyone. I think from a chain perspective, or specifically from a Lawrence and Mayer perspective, I think the first wave when it came, I guess we were all not prepared for it. So from a large perspective, when it came to managing costs, managing inventory, I think it's something that we just started working through during the lockdown. We didn't really have any plan or any thought process around it. But somewhere down the line, I think we kind of touched a chord with our own people when we stayed with the course and actually paid 100% even during the lockdown period. And then eventually when we looked at our, so in a big chain perspective, for example, what you need to look at, or what we do look at, is not about only whether we can afford to pay it now, but can we afford to pay it over a sustained period of time, because that's something that we need to factor into consideration. And I think when we did that working, I mean, like Rajesh ji said, I mean, a cut was something that we needed to do. And so I guess somewhere anywhere between 20 and 25% was the kind of cut that we did for each person within the system, depending on certain grades. Obviously, we try to apply the cuts more for the higher grades. And for the lower grades of people, that is the office assistants and things like that, we try to avoid the cut completely, because at that level, I think it kind of makes a deeper impact. So that was on the salaries front. I think going forward, I think what we kind of try to work with the team in the system is that I think if you accept the reality that this kind of uncertainty is going to be there, then we, like Rajesh ji say, have to become partners in that uncertainty. It cannot be an uncertainty that is only managed by the owner. I think it's an uncertainty that has to be jointly managed between the owner and the team together, right? So I think that's something that we worked on in terms of trying to get that understanding across. So as optometrists, since I know I'm largely addressing optometrists here, I guess the perspective I would share would be that I think optometrists need to understand that eventually any practice runs on the basis of some kind of financial model. And therefore, their contribution to the financial model has to be not just about coming and going and things like that. I think it's about contributing to the practice. And I think from that angle, Nilesh, on the second phase, what we've tried to look at and tell people about is that, you know, if we do 60% of the sale or we do 70% of the sale, then that's the percentage of income you'll get. If we do 100% of the thing, then we will actually be happy to pay you 120%, even, because I don't know whether we can do 100% in this kind of scenario. So the reality is that's the kind of model I think at LNM we are looking at, and I think it's kind of, you know, I think the key point I would only stress on is that that I've been working on is more that the acceptance of uncertainty. I think that's something that we need to, and I do understand people have EMIs and loans and many other things that are there. I don't think we have been able to do much as far as landlords are concerned. By and large, fixed costs remain very fixed. And I don't think, I mean, electricity and those kind of things, because we can control, but rents and stuff like that, it's been very, very difficult to manage. And therefore, once there is a greater acceptance of this, I think it is easier to manage. That's from my side. Thanks.
Yeah,
Yeah.
I think it is summarized very well, and I think all of us are facing this for the first time, right? So no one was ready. No one had a particular answer to these questions. We all, learned and we found our answers as we went along. So if Ajay and Snehal, if you just want to add quickly, if there's anything, or I can ask you the next question. Something like whether you retained your staff.
Yeah. So I think our an optical kind of setup, especially retail, at least most of the groups I think have refrained from sacking. And as Amitabh said, we have somehow rather tried to manage our cash flow so that we are able to retain our staff, and it has largely happened that way. During the first wave, it was very tough for the management to take decisions because we never had to think on these lines, how to do salary cuts, what kind of increment should we do, and incentive cuts, etc., and all that not only during the lockdown, as also the subsequent period where there are going to be diminished returns. But the fact is now the staff, it is sunk in very clearly for them, and they are mentally prepared, and that they know that they have no go, and they are very accommodative, to be very honest. And I think for going forward for a couple of months till the business reaches a reasonable threshold, it's inevitable for all business houses that the employees will also take a fair share of cut, and increase in salary, or rather than extent of reduction of pay cuts, will be kind of proportionate to the business recovery.
Right.
This is very important because this also helps that the entire team is focused on doing the best they can to get the business on track.
Awesome. So what I'll do is, I think, meanwhile, guys, if you are listening to us and if you have any questions, please feel free to put your questions as well as comments on the Facebook, and we'll take as many as possible. So I'm going to ask Ajay something else. Ajay, now patients are coming back. So how are you managing the patient flow, their appointments, and if at all you take any precautions? Because now the entire discussion will focus on now and future. Whatever has happened has happened. We can't undo anything. So let's focus on what to do now and what to do in next 6 months to 1 year. You're muted, Ajay.
Sorry.
Yeah, go ahead.
So when now we are in the process of unlocking, and patients are not coming in a kind of we don't have a lot of patients right now, so we have very limited number of patients. So managing appointment is not an issue. However, managing showing them that we are absolutely, you are in a safe place, so the things are absolutely sterilized, that is a bit of challenge. So what we are doing is when patients are coming, we are making sure that everything is being sterilized in front of consumer, so that they get a greater amount of satisfaction. However, the things are being sterilized before and also, but then what we have realized is if we are sterilizing in front of consumer, they feel very safe, that I'm in a safe environment and this is the place where I should be. So this is what the extra thing what we are doing. Rest all is almost same, except barring this ophthalmoscopy and going closer to customer. Rest all are same. So things are shaping up. And what we have realized is that people are now coming
back
with a family, because earlier if you want to go for eye test, you can alone go from office and you can have your eye test. Now things are being planned, so the family travels together, and we are getting opportunity. I think, am I audible?
Yeah, you are.
Yeah. So things are little bit different when people are coming along with their family members. Same time we are getting an opportunity. If the family members are there, they first of all they feel very safe because none other patients are there. They along with their family. So we get an opportunity to test other family members' eye as well, and thus it is converting to orders.
Of course.
So things are shaping up.
Yeah, so there is opportunity in diversity. Yeah, Lakshmi, go on.
No, I just wanted to say, like to hear from Snehal and Rajesh as well. I think we've learned a lot from the first wave. So first wave, yes, it was a big this thing that, oh, we have to sanitize this, sterilize this, and it was a huge burden on our head.
Yeah.
But I think with time we somehow have developed that routine, that now it's become part and parcel of every eye exam. I just would like their comments as well. That's how I feel. I don't know if others feel differently.
Yeah, see, it's very much the new normal now. As you said rightly, the sanitization all has become an integral part of our daily routine. But yes, going forward, the optoms they have always played, but they'll be playing a very crucial role in aiding recovery of our business. So as we all know, that clinic practice is a critical aspect and often the starting point for most opticians. Okay, this is where the person first gets into it when he goes to the optical store. And the first impression is going to get over there. He's going to be there and then come out for a good 30 to 40 minutes. He's going to spend time. And what's the standard the optometrist is going to set in terms of hygiene, comfort factor, that's going to make a lot of difference to the customer mindset. So I think, initially in the past, the patients were hesitant, but once they see a very clean, hygienic setup and proper protocols are followed, they get extremely comfortable and they are then very relaxed for the remaining part of the time. And most importantly, I think this experience which our optometrist is going to give will lead to word of mouth within their peer circle. Okay, as we all know that today with a lot of limitations, one of the things which we all give is opinions and suggestions. It is available for free all the time, and right now the pandemic, opinions, suggestions from peer circle is at all-time high. So I think it works in our favor for a good job done by our optom and our team members.
Great. Rajesh, any comment on the appointments also?
Thank you, Snell. Actually, two things here. One is that fortunately, all of us who are sitting here and talking, our audience is also an educated group. We are not really in a group which is not listening to the television or not reading newspapers. And the studies have already shown that the element of surface to human transmission in this pandemic is very, very low. It's primarily human to human. And most of them know it. So that little factor, that paranoia is almost gone in the cities. And secondly, accepting that we don't have the footfall like we used to have. We have few people. So we are openly telling the patients, you come in, we will organize that no other person is going to be there. And actually we don't have another person. So they are quite happy. They come, they get the things done, they move out. By that time, another one comes, whom we can accommodate in a separate portion of the premises or in the clinic for some time. All that happens and it's going comfortably in that aspect. Now we rarely meet people who are so paranoid. Those who are, they would want us to send things home or things like that. Or we also provide outside the shop delivery because our outlets are just on the main road. You can the boy can move out and give. So that kind of things and all those are working fine now. Thank you.
Awesome.
Yeah, in fact, Rajesh, what's surprising, at least in South, what we are seeing is, as the hospital setups is pretty huge in the South. One good fallout of the pandemic, especially during the latter half, was that we saw a lot of people not wanting to go to big hospitals or big setups, because they had the fear of, whether they didn't want to go to a place where they may probably contract something. So they were much more happier coming to outlets where, at least they know that they can get in, get out swiftly. So that has played a very important role, because though our businesses had fallen, proportionately our testings did pick up, especially during this latter half of the pandemic.
Very true. Awesome. And also we see that we can spend more time with the patient. We can do more counseling. Even at the counter, the staff can upgrade the sales. That element has come in because they have adequate time and they don't have a pressure of seeing the other person who is waiting in the queue to be. And so, yes, maybe the total number of patients may have reduced, but total revenue has not proportionately reduced. Revenue has gone a little higher than what it would be in the same percentage of patients.
So the quality is improving. The quality of service is also probably improving. Spending more time with our patients. And I intuitively feel that now, because of all these situations, instead of directly walking, I think there will be more appointment-based patient care. Is it a good hypothesis?
That's true. That's true.
That's true?
More people call up to fix an appointment, and we assure them that we are not
Right.
giving
So,
this
so
time.
it's easy to manage as well, right? So next one, probably I think I'll come to Amitava because he just mentioned that during answering the first one, and maybe Rajesh ji and Snehal can add to that later. It's a good question actually, and I'm happy that an optometrist asked this question. The question is, we are all understanding, the customer flow is less, and we want to help the employers to grow the business overall. So as optometrists, what we can do, and I think in continuation, the next point is we all have a little bit more time on hands probably because of the situation. So how can we positively utilize this time? So it's a combination of two questions. Maybe Amitava, you can go first, and then we'll come to Rajesh ji and Sneha.
So Nilesh, the only reason why I had a little smile when you asked me that question is that you're actually asking a person who's not an optometrist that question. That is, we are asking a businessman how to grow a business. So I'm comfortable. I'm comfortable answering that. So I'll answer both sides. So the first part of it, if you ask me, is that yeah, I think the crux of what I want to communicate is the fact that I feel so inherently when I've been taking interviews over the years, and I've had an opportunity to interact with a lot of optometrists and some wonderful people that I have met as well. One of the things that I have realized at somewhere down the level is that most optometrists do harbor an innate desire to, at some stage, have their own practice, and something that they'd like to do. I don't say that it isn't. I think it's nearly 7 out of 10 people that I've come across that at some level they want to express themselves through that approach. So it's something that why I say that in reference to your question is that I think somewhere down the line you really don't need your own practice to be an owner. You can be an owner in anyone's practice as long as you have the feeling of ownership within you. So I think if you have the feeling of ownership within you, I think that's a lot that you can think of and try to find some opportunity in the adversity. So some examples that I can share with you is specifically would be, so I think the first perspective is, as an optometrist, I should be open enough to realize that the store walls will not be enough for me to meet my business requirements. I will need to open the possibilities to the extent that I may need to go out. So if it's a home eye test or a home service, or I need to be able to deliver, or I need to reach out to my client, if the client cannot come to me, is something that I think we need to be mentally prepared and be ready to do as service agents of the business. And that's one aspect that I feel is very important. The other aspect is, I think the usage of technology, for example, like WhatsApp. I think it's important that whether it's small practices or big practices, I think you need to start leveraging those things to keep in touch with your clients. Mm-hmm. I think even today people are breaking frames when they're at home in lockdowns. There are people who are losing something. Their child is having some problem. Somebody needs a contact lens solution. These are things that are still happening. And if the practice is ready to at least reach out, find a solution, be in touch, I think so. I think the critical element would be that I think we need to stay in touch. Not say that nahi yaar abhi lockdown hai, so I can't do anything about it kind of thing. I think that kind of approach needs to be there. The third and last that I would add to my list of things would be, I think somewhere down the line also it's important as an optometrist to look at I think sometimes optometrists tend to be overtly in the clinic types. Clinical. So I think that would also need to undergo a little bit of a change from a perspective of how the business is getting structured today in the future. And it has nothing to do only with pandemic. I'm talking more from the perspective of the fact that we have to recognize that there are different components that trigger business, not only clinical. So there is a whole perspective of fashion, there is a whole perspective of comfort, there's a whole perspective of convenience. Convenience is becoming such a big factor in the way people make decisions. So I think those would be the few things that I would encourage optometrists to look at. Last point of yours was what would I, what my suggestion, what we have done with our optometrists is, For us, honestly, as a brand, I think we're pretty passionate about the clinical side. I think sometimes we could do more than what we are currently doing, but definitely we are passionate about it. And I think somewhere what we've looked at is actually, just because you're clinically good doesn't mean you know too much about a frame, or you know too much about fashion, or you know too much about the other aspects of the business. In fact, I think there's a whole curve that you need to unlearn to learn that, in terms of trying to understand, because whatever you view is through the prism of, whether this is a right lens kind of stuff. So I think at LNM we've been spending a lot of time on that. Very honestly, that's what we've been doing, Nilesh. Thanks.
Awesome. Thanks so much, Amitav. And I'm sure Ajay is smiling because he's also an advocate for optometrists coming out of the clinic and getting involved in dispensing and other stuff. He was actually in one of the debates for this particular point, and that's why he's giving so much. Anything you want to add, Ajay, to what Amitav already mentioned over and above?
Yes, sir. Playing these optometrists are playing a really vital role in this during this pandemic period. Now, we as a management in a chain store like Amitav, we have a dual responsibility, engaging our customer, and then when I say engaging our customer, not end user or not consumer. For us, our customers are these optometrists or my staff. So we need to engage them too. And during the second wave, which was the most severe one, उतना ही seriously हमने engage किया अपने optometrist को. So because क्या होता है कि when you engage them, they feel like, okay, I need to do this and that. So almost every alternative day we have either in-house training or training from our partners, business partners, be it frame company, Luxottica, or maybe from other contact lens partners, contact lens companies. So we are keeping them engaged throughout. So they are feeling motivated. जितना उन्होंने पिछले 10 साल में पढ़ाई नहीं किया है, उतना उन्होंने पिछले एक साल में उससे ज्यादा पढ़ाई किया है. So what we believe is कि आप circumstances को हम change नहीं कर सकते. What we can change is we can change ourselves. हम इतना motivate हों और अपने customer को फिर क्या करते हैं हमारे optometrists. Now those optometrists, those who are working in malls, they cannot go out and because their store is closed. So they themselves are getting in touch with their customers, and consumers are finally giving them orders, and we have booking a number so they can pay well, and send us SMS that भाई मैंने pay कर दिया और मैं head office से huge amount में यहाँ से contact lens solution सब dispatch कर रहे हैं दूसरे cities में जहाँ पे lockdown लगा हुआ था. So we are serving them. Also during this pandemic we have started our home service. This is a new vertical we have started in this pandemic period only. So we are going to customers' house. Customers cannot come to us. We are going to them with our expertise, with trained staff,
but without compromising the clinical
without compromising.
I think ये बहुत जरूरी है.
Yes. So we have invested a huge amount of money. I mean, to start this home service, we have one of the best equipment, which is and I think we are the first one to buy this from Nidec. It is portable auto refractometer and everything. So we are going with that stuff and doing a reasonably good job.
Right. So being proactive, I think, is the word here first, and secondly, अच्छा one-liner याद आया because we're talking about adversities, that you need a certain darkness to see stars. Okay, so ऐसे situation में you will actually know who are your shining stars, right? So I'm going to ask Rajesh ji and Snehal also, कि at individual practice level, how did you utilize your time? Rajesh ji is the master of getting himself educated and updated. So anything specifically you did, or
we are not masters of anything. We are all learning from each other. I'm learning from you all today. So that's how it goes. Two things I like to emphasize. One is whenever we induct a person into our outlet, whenever the appointment is done, every person is told, your job is everything. Only your primary job is this. So with that, the concept is open. I work as an optometrist myself in my clinic, and I attend to the counter also, and I look at the dispensing workshop also, everything. And so would others be expected to do? And this being one, so this always helps in plan B. In pandemic, so many issues have happened. Some people cannot travel, others are still sick, others have had some issues in family, so they can't join, others may not even join. So just to fill in, your optometrist can fill in almost everywhere. So one is this. Secondly, to boost up the sales and use the extra time, let us look at the 80-20 rule. In retail, mostly it is said that 20% people give you 80% business and 80% people give you 20%. So those 20%, when they visit you, they would be buying something which is more premium, more expensive. For example, say progressives. We can always spend a little extra time talking about progressives and upgrade their progressives. We can upgrade their frames, or maybe we can upgrade the coatings, the surface coatings of the lens, all those, and then earn some extra revenue. All these things can be done. Plus, we also started now to charge for our consultancies almost to everybody after the pandemic. All said and done, the sanitization and other things and compliance and whatever be the issue, low footfall, our expenses versus the input, the cash flow, the ratios have changed. And we have a right to charge, so we charge our professional fee. And I don't see too much resistance to it, at least in our outlets.
Great.
That's also adding to the revenue now.
Awesome.
Yes, over to you, Snell.
Snell, anything additional?
Yes, as Ajay mentioned, I think continuing education is the key for not only the optometrists and all other staff as well.
Right.
And there's no dearth of information flow in our field, thanks to several organizations who are carrying a series of webinars, excellent webinars. So I think a portion of everybody's optometrists and the management as well must be used as a matter of principle to attend such webinars, which will not only refresh the knowledge, but also help you stay abreast with new developments. The pace at which newer things are happening is so phenomenal. And let's not forget that today's patient and consumers are so well informed. And in fact, they do a detailed study of what they're coming in for. And many a times, the optometrist or the staff is stumped because he does not have that much information as the person is having, consumer is having. Yeah. So it also helps the optom to maintain a high level of confidence and self-esteem, as you stay abreast with new happenings.
True.
I think that optometrist plays a crucial role in training other staff as well, especially in smaller organizations like ours. They have to multitask as in any establishment, and we have seen that often this brings out excellent latent qualities in them, and it boosts their confidence as well. Yeah.
Awesome. I think एक चीज तो हुई है.
Nilesh,
I
just wanted to add one point. I don't know whether it's with the flow today, but I do feel that it's important, since it came up in both the speaker with them. I think somewhere, and since I'm talking to largely an optometrist audience, I firmly believe, and this is something that I have often articulated, and even on the industry forum, which I'm now a part of, I personally, I do feel, Nilesh, very strongly about the fact that services from optometrists need to get valued. And I think this is very, very important. And when Rajesh ji said about the professional charges being separate, and I think the problem is that different practices follow different approaches, and we need to come to some agreement on one approach to value these services, whether it's contact lens workup or it's eye examination or whatever it is that you're doing. Because if you don't value these services, I don't know how you're going to grow the image of the optometrist because everywhere else there is a value that is paid for a service. True. So that's the only point I just wanted to add. I think in the pandemic point perspective also, I think those services are valued.
Absolutely.
Right. And if this is an opportunity for us to look at valuing these services and not giving it free or running campaigns around it, which I think at some level we all are guilty of at some level. I mean, I'm not saying we're not, But I'm saying that somewhere down the line, it should not be that I'm doing it, then other people are doing it. Main kya karu? So it becomes like, I think somewhere we need to look at this. And I think it will go a long way in making an optometrist focus on delivering a very high level of service.
May I add something here?
Sure.
Yeah, Rajesh.
See, the point is, do we ever see this kind of thing among dentists? No. Every dentist will charge you professionally. Why? Because they are licensed. Optometrist term did not exist until March 2021. Optometrist licensing did not exist until March 2021. It's just been just few weeks, and it'll take about 2.5 years. And in that much time, we will see with the allied National Commission for Allied and Healthcare Act, which has come in. So with that, now the professional fee will become compulsory. You got to acquire a license. You got to put in continuing education. You have to pass the exams. You got to invest your resource into it, time, effort, money, everything, and then you get license after a lot of effort. Awesome. Plus your basic education that you do. So who would give it for free? Plus the equipment cost, everything will now count, and there'll be all those outlets who are not running with an optometrist will look for optometrists, and their value will automatically go up. And with this demand coming up, which I see happening by September 2023, all the councils have to be in place. And there'll be huge penalties for not being an optometrist and calling themselves optometrist, something like 3 years imprisonment and 2 lakh rupees of fine. So with all that in, obviously professional fee will set in. Let's start rolling it, maybe in the light of pandemic or whatever, it'll happen.
Exactly. And some of you are already doing that even before the pandemic. And I'm sure Rajeshji, and we don't have some people right now, but they are very much pro charging professional fees, and they've been doing that. So I think this pandemic is working as a catalyst in a way, in terms of adapting to and adopting technology. I think this has worked phenomenally well for all of us. It's actually pushed us to adopt technology. We at other organizations also, what we couldn't have done in, let us say, 2-3 years, we had to do in 3 months and get on board and start working quickly, right? So we were adaptable, we had to be agile. So it has definitely helped us by pushing us into it in a way. And Amitav, I'm sure all the optometrists who are listening right now, they're going to love you for what you said, the value they bring, and that we need to charge for our value. I think all of us are waiting for that to happen.
Yeah, I was so happy to hear from you, Amitabh, because we've all been banging our heads and saying, please charge, please charge.
Yeah, you can't undervalue yourself. Unless you value yourself, who else is going to value you, right?
Exactly.
So, yeah, absolutely. There are a couple of, Lakshmi, I'll come back to you. I think Saranya has mentioned a question and a comment. I'll read the comment first. It goes well with what we were talking about. The system of appointments that we have been struggling with implementing, especially in smaller towns, has actually become a fairly good norm now. So it is working, right? So people are working on appointment and things like that. And she also has a question, maybe a couple of you can take that. Post-COVID, is there going to be a different set of expectation from our patients in terms of time we spend with them, etc., or anything else? Are the patients' expectations changing? Maybe those who have started seeing a little bit more patients can comment on that. Could change or in terms of expectations?
Expectation in terms of cleanliness, hygiene, and this will continue. This expectation will go up and up, because now people are going to expect that you have to have a crisp and clean clinic, and you have to maintain a proper hygiene and proper sanitization and sterilization. These expectations are going to go up.
May I add to what Ajay just said? Actually, Ajay has absolutely correctly said that. But in terms of time, the patient expects that it will be crisp, quick, and he'll be out. He doesn't want to be in the premises, so there's an inclination to run away. Okay. And we got to be very accurate about what we are doing. No beating around the bush. No dilly Just do the job quick, and you may even tell the patient it couldn't have been faster, and patient will say yes, that will be good. But faster doesn't mean we have shortcuts and we compromise on service. No, it will be only quick. It's not that, "Arey bhai, pen kahan hai? Where is that paper?" Go. No, those things are anyways bad management, but
Yes.
that is absolutely unacceptable in
Unacceptable
today's
now,
time.
right.
Yeah.
So things which we could get away with, no more. Snehal, ठीक है ये या anything else you think?
Absolutely, yeah, yeah,
You agree?
yeah.
Okay.
I just had a comment, Nilesh, to what Amita was saying earlier in terms of, taking a step forward in terms of moving away from the comfort zone and all of that. I just had a question to all of them saying, how has social media helped, during these times? Have you all stepped up in terms of presence in social media? Has it helped you? And things like that, even small stuff like WhatsApp with customers, and how active you need to be in order to get more footfall in the clinics, both independent and
So, can I answer?
Yeah, go ahead.
Yes.
Okay.
Yeah. With regards to social media, during this pandemic, social media was the only option we had to connect with customers.
Right.
so whatever business we got, it was 90% through social media during lockdown period. We absolutely WhatsApp marketing, WhatsApp media was one of the best and phenomenal. And then other platform like Instagram, Facebook, and other platforms were there. But WhatsApp was the most successful social media we found.
Okay.
Of course, we need proper licensing and proper tie up with WhatsApp to have this facility.
But it worked well in your practice. Okay. Anyone else?
Yes.
Nehal, kuch?
I think for the independent opticians, one big positive followed the pandemic for many practices was that they had to adapt and be proactive in social media, even if it was a small beginning. This medium is now inevitable, and for still those who are not adopted, you need to start, as it takes a good period of time to understand what concepts works best for your practice and to stabilize and see the results. The flip side is that right now everyone is vying for a space in this medium and to catch the attention of potential customer. And it's not as easy as it sounds. Not only the opticals, but in all other fields as well. You're bombarded with marketing. It's an overdose. There's too much information to grasp. But yes, it's inevitable. One needs to really plan and spend wisely to see results.
So for to catch new customers, this media may not work. But to get in touch with your old customers, communicating with your own customers is, I think this is one of the best medium.
Absolutely.
Awesome.
They really entertain.
एक बहुत direct question है, but I think it is very important, and probably we may not have a direct answer, but anyone has any thoughts on that? Kumaranji has a question. He's saying that, can you give any suggestions to improve the footfalls? Because now we want more patients to walk in, and how do we retain them? And basically on this line, how do we?
If we have direct answer of this, I will be millionaire. Probably billionaire.
Absolutely. So nobody has a direct answer. Absolutely,
Yes.
I understand. Anyone else wants to add any thoughts, or shall we?
I think there's also.
Can I just sorry? I just wanted to answer that one on social media when you were referring to. I think again, if you ask me personally, if we look at social media internal, as like Snehal said, I think the smaller guys have to look at getting into the social media game, or for that matter, even into the online game to whatever extent. Because I think it's not so much about new customers as it is about keeping your existing customers with you. I think somewhere down the line, you need to keep the connectivity with the clients. So that is where I would look at it if I was running an individual practice. And in LNM, I try and treat most of my practices as individual practices anyway, not really as a chain practice, because in reality, if you make it a chain practice, then you're really looking at one idea fits all, and one idea never fits all in a geography like India. Right. So it never works. And what I do in Chennai may not give me the same results in Calcutta, and so on and so forth. Even with frames, in anything that you do, actually, the trigger points of consumers are very, very different. The coming point of the suggestion that I had, it just came to me as an idea, I just share it, is that when you look at social media, and I think what the optical industry can do compared to as a lead over other industries is that, we are getting special permissions like essential services. We come under these things. But unfortunately, we are all very localized. if there is an active social media campaign saying that optical places are safe, you can go and get your eye test done. Doesn't matter what is the name of the optical practice or whatever. I think you will have traction at some level or the other. But the point is, it's so minuscule what I am doing or what maybe Snail is doing or whatever. You're not going to be able to reach anything that's going to, result in some business. So that was the only idea. Yeah. Thanks.
Yeah. So thanks, Amitav. I'm going to read out an interesting message. It's a post, not a question. Vijay Nagleji, he's just sharing his experience that during lockdown, my clinic is open, but I cover all my spectacle display. I have fixed time, provide essential services like emergency service, ophthalmology referral patient for post C3R, etc., etc. I visit COVID ward to see patients. As clinical practice, there's a lot of work. I made my crutch classes, prosthetic eye, prismatic correction for diplopia correction. Routine patient also come for spectacle, etc. So it seems that he has been very busy in his clinical practice and he's doing things outside optical also, and he's following all the protocols. So congratulations, sir, for doing all that. We really appreciate it. Yeah, I'm just coming to last couple of questions now, and again there are more direct questions. One is on contact lens practice actually, because we've been hearing maybe contact lens patients not discontinued, but reduce the contact lens wear in the pandemic. So has it picked up now? Maybe Rajesh ji, Snehal, you can take it up because more into contact lens practice.
Yes, new cases are not so many.
Okay.
But old cases, yes, there's a delayed demand because many people did not use contact lens. We all know that biggest reason is for contact lens is cosmetic. Some people did use too much of digital devices. Those who were too keen on it, they used contact lenses at that time. Others felt 10 hours of use of digital devices, contact lens on was causing more dryness. They forget to blink and all those issues. So contact lens has been a mixed thing. New cases are down, but some people are coming back. The backlog of the orders which were pending, they are now coming in. People want to spend, they have not spent for a very long time. So they buy bigger supplies than they were earlier buying. Yes, it's coming up as a mixed response.
Okay, so we're getting back there.
Yeah.
Okay, yeah. So Snehal, similar or
very similar. In fact, to be honest, we really didn't miss much of the drop in contact lens business because we have found that active contact lens users were coming in to make additional spectacles, be it Blue Protect or whatever it is, and in some way it helped our business. So there's no complaints as far as that is concerned. But yes, it's only a matter of time before these people will get back, and you can expect a spurt in contact lens business after a couple of months.
Right. Now, Ajay, anything from the chain point of view in contact lens?
Yes, sir. Initially, in first wave, people were, they were saying the same thing that I'm at home, so I don't use too much of contact lenses. But now, during the second wave, people are now realizing that my home is new office, and therefore they are back to same attire. Okay, now I need contact lenses, and we are getting calls from customers. It is now reverse in second wave. Now earlier we used to get in touch with them and sir, ma'am, आपका contact lens का supply exhaust हो गया, नहीं अभी जरूरत नहीं है. Now they are calling us and saying that send me your contact lens supply, and we are doing reasonably good now.
Okay,
so contact lens is picking up slowly. But picking up, yes.
So back on track, and next few months look positive. Yeah.
Yes, absolutely, sir. We will be absolutely at
awesome. Good news for everyone. Lakshmi, you are saying something?
No, and the follow-up for specialty contact lenses has increased because they've missed out on such a long time. So and they are quite worried about their eyes. So the follow-up for all the different specialty lenses, and that has kind of gone up in the sense whatever you missed, all of those, the backlog is what you're looking at.
So it's coming back to the pre-COVID times. Now, an interesting comment from Saurajit. Due to COVID, the hygiene awareness among the consumers have been huge. So we can use this as an opportunity for contact lens and other eye care services. Thanks, Saurajit. I think we've taken that. Now I'm going to end this session on a positive note. So maybe each one of you, I'm just going to ask you the same question. That in last couple of months, maybe you might have seen some nice, interesting, positive success story within your practice, and you would like to share that with us, or any trends. For example, if the patients are coming back to you, what kind of stuff are they buying? How is it going? Is it looking positive?
Yes, sir. Absolutely. So we have many customers. Those who are from. See, we have two type of customers. One are middle class or upper middle class, and then you have HNI and ultra HNI customers.
Right.
So these ultra HNI customers are now, when they are coming, what we have realized is HNI and ultra HNI customers, they are buying, their ticket size has gone up. So earlier, if they used to buy, say, make the bill of say 1 lakh, now they are making a bill of 3 lakh, 4 lakh rupees. So this is this is surprising, and we are very happy. We have seen that during this pandemic, our ticket size has gone up, and it has gone up significantly. It is not like 200, 300, 400 rupees. It is significantly gone up. So the future is bright. What we can say is future is bright. We don't have to forget our basics. We have to abide by basics, and then future is absolutely bright. Darkness is over. ज़्यादा डरने की जरूरत नहीं है. प्रिपेयर करना है, रोना धोना बंद करना है, कोरोना का रोना बंद. अपने आप को प्रिपेयर करिए और काम पे लगे.
Okay, good.
Yes.
Anyone else wants to say anything else?
Very similar pattern compared to what we saw in the beginning of the first pandemic unlock. It's also got a lot to do, I think, with human psychology. You know, that people have gone through extremely tough periods in their life, and they have endured a lot, and their entire thinking changes. Suddenly it's like people feel that they need to do something for themselves. They want to indulge. They don't want to miss out on good things, and they feel they deserve something better. So this is a very good human psychology which is working for people who have been suppressed. So this is definitely, as Ajay said, we are seeing, especially last few months, we are seeing a very, very distinct spurt in people are willing to spend a higher amount and willing to indulge. And I think as more and more people are getting vaccinated and COVID, they have gone through COVID, and after the initial reluctance, they will start moving back to routine with precautions, of course. First time around, there will be a lull, of course, like first time. But I'm very confident that this time the lull will be for a shorter period, and we can expect a relatively faster and decent recovery, since a lot of factors have already been discounted for.
Awesome. Rajeshji?
I think most of it is covered. Yes, people have now realized that life is rather uncertain in this second pandemic, and they want to live the best they want to. But yes, there are two groups. The say middle group moves upwards, and lower middle group has moved downwards. They've had a lot of losses and all, and we have that kind of people also who were earlier taking the very high value products are now wanting something to do with it, like travel business is gone. Many businesses have gone. So it depends what it is. But overall average, I think it's been okay. And we are satisfied with about 2 weeks of work which we have done. And it's picked up pretty well. We are busy all day like we were earlier. Only patients are spaced a little more.
That is so good to hear. Just a quick one, Rajeshji. Is there any shift in terms of contact lenses, any shift towards daily disposables or small packs, or any shift you have noticed yet? Or
since we've not had too many of new cases, old cases are just repeating what they were used to. Although we do tell them to take dailies and all, they say once we visit you and we sit with you, we'll discuss with you. So in these 2 weeks, there has not been much shift to dailies. But as it is after the first pandemic, there was a huge shift over next 6 months towards dailies. Yes.
Okay.
So that may come in. Yeah. There was after the first pandemic. Yes.
Awesome. Amitabh, anything from your side?
No, I just add to what I think already everyone has said on. I think the luxury segment certainly is seeing a very decent growth. I think the branded and the luxury both, which is very contrary to our expectation. I mean, to be very, very honest, but it has been sustained even the first wave as well as the second wave. So I think the opportunity here is basically that a lot of people can't travel. And a lot of the NRI, while we have lost from the perspective of maybe NRIs coming to India, I think there are a lot of Indians who go abroad and do a lot of shopping. I think the other way is also something. And I think also a lot of people are not being able to visit their parents and who are in India and all of that. So I think there's a lot of things that we can work on in terms of how the business can be looked at from the perspective of when we guys are able to reopen. So luxury segment for sure. I think the home space that Ajay talked about, I think that's something that it's important for us to all look at, because I think not so much that we will get so much new customers out of it, but the existing customers themselves maybe need to be serviced in a way which is where you don't always wait for them to come to you. You'll have to kind of go out and reach out to them. So I think that's another way. And then last point that I would add is only from the perspective that I wanted to cover, which I guess somehow I didn't, was on the optometrist side. I think from an optometrist perspective, when I was thinking about it, this morning, another thought that came to my mind was, like any other profession, Nilesh, the perspective that I have is that while I said that I think most of them think like owners and they want to be owners someday of their practices. And I think that's a very noble thought. There is no issue with it. But then I would only say that if you want to make those dreams a reality, then you need to understand what an entrepreneur goes through and make sure that you learn to do that in the place that you are right now. And if you do that, then you'll kind of earn a lot more stripes in getting to your dream that you want to achieve. Thanks all. That's it.
You need to go through the grind, not just dream, just work on it. Yeah, thank you so much. I think this was really phenomenal. I myself learned so much, got so many insights, and it seems that, after whatever, a year or so, things are looking nicer, things are looking brighter, and definitely we have learned something in last year. Certain things actually worked in our favor. For example, hand hygiene. People started believing in hand hygiene, and they have started washing their hands more often. It helps us in our contact lens practice, right? So things like that are working in our favor. Overall, I think next 6 months will be interesting. And if we have learned certain new skills and if we continue to do whatever we have learned and apply that in practice, maybe next 6 months and a year after that could be brighter than it has been even before 2020, right? So we can not just come back to our normal, but go ahead, think ahead of where we were from the beginning of 2020. So guys, thank you very much.
Hopefully we don't have a seesaw. Third wave, first wave, second wave, third wave.
Don't even talk about wave now. I feel like it was.
Thank you, everybody. Thanks.
Thank you,
guys. Have a wonderful evening.
Much.
Thanks for all your time, everybody, including Nilesh. Thanks for your time as well, Nilesh.
Thank you.
Thank you.
Thank you, Lakshmi. Thank you, everyone. Thank you, Nilesh.
Thank you, everyone.
Nice meeting all of you. Thank you, Snehal. Thanks, everyone. Yeah. Thank you.